Okay, so you've been told that you need an epidural steroid injection. What is an epidural steroid injection? People get confused because when they hear the word epidural, they think, oh, that's what people get when they're having a baby, to have anesthesia for having a baby. But epidural is simply a word that describes a space in your spine. It is an anatomic description. It is like saying, I'm going to go to my bedroom. Your bedroom is a space that you describe. So when we say epidural, it's a space in the spine. If you look at a model of the spine, you'll see that if we look down on the end of it, you'll see there's a column of bone that goes around what is the spinal cord. So this would represent the spinal cord. Outside of the spinal cord, and outside of the covering of the spinal cord, but inside the bony canal is a space that's called the epidural space. And it is a space where we can inject medication to have different type of effects. So if someone is having a baby, we can inject anesthetic medication in that space and it numbs them up and they can have the baby without having so much pain. But in the case of an epidural steroid injection, we're trying to treat inflammation of the discs or of the nerves in the spine. And we're injecting steroid medicine into that space. So that's why it's called an epidural steroid injection. Epidural is where, steroid is what, and the injection is how. And the purpose is to reduce inflammation. So when you look at a spine model, you have vertebrae bones that line up in a column. And in between those bones are little cushions, shock absorbers that we call discs. And those discs over time start to wear down and they get arthritis and they can get inflamed and they can swell. And as you can see, these are the nerves that come out that turn into the sciatic nerve and go into our legs. If that disc swells, it's very close to that nerve and it can press on that nerve and cause inflammation in that nerve. And that results in back pain or leg pain that people call sciatic pain. That's a type of pain that radiates down your leg. So when you have arthritis in your back, degenerative disc disease, a disc herniation, a disc bulge, in the old days, we used to call it a slipped disc, but that's not really a good descriptor. But all of these things cause pain in the back, pain in the legs, can cause weakness, discomfort, disability, and they're very disabling and limiting. The epidural steroid injection is a way to reduce the swelling and get pressure off the nerve. Now understand this, it is not a cure in all cases. In somebody who has a bulging disc from an injury and you inject it, sometimes that's the cure. It gets the pressure off the nerve. Years ago, I had a bulging disc from an injury. I had one epidural steroid injection. The pain went away. I haven't had pain there for the last 15 years. But most of the time when we do epidural steroid injections, they're for arthritis that is not going away. And so we're trying to reduce the acute pain, reduce the acute disability, and then get you on a program to get better as you go down the road and to manage it and to maintain it where you don't have to keep having epidural steroids over time. It's about empowering you to make yourself better. The epidural steroid injection is the boost to get that pain off, and then it's up to you to do the things that get you better. Exercises, eating right, all of those things, which we help instruct you on. We do the injection, and then we lead you down the pathway. We empower you to make yourself better. So the actual injection is done right here in a room like this. This is our procedure room. It's done, you come in, you have the choice of having anesthesia or not having anesthesia. Some people want to have a little IV sedation that makes them calm down, relaxes them. It's easier for them. It's easier for us to do. But about 15 to 20% just want to do it with a local anesthetic. And either way is fine. You come in, we start an IV, we bring you back to a room just like this, and we give you a little IV sedation. We have anesthesia that comes into our office to do these procedures. And if we do it in the hospital, we have anesthesia that comes and does it there. We give you a little sedation, it relaxes you. It takes me literally 3 minutes to do the procedure. And what it consists of, we use a special live x-ray machine. It's called a fluoroscope. This is our fluoroscope in our procedure room right here. The fluoroscope sends an image to this monitor. I can see the spine in live time. I can see the actual vertebrae, and I'm aiming at a space between the vertebrae bones. And what I do is I use a specialized needle. It's called a Husted needle or a Tui needle. There's two different types, but the type of needle, if you can see, it's hard to see on this video, but the tip end of the needle is curved so that when it goes into that space, if it does come in contact with a nerve root, it just pushes it to the side. It doesn't puncture it. We use that needle to direct down using the fluoroscopic image. So we're seeing this image on the spine. We guide the needle down into that space, and I use a special type of syringe that's called a loss of resistance syringe. This is the loss of resistance syringe. And what we do is when we put that needle in, the needle is going into a ligament. And right when I break through that ligament, it goes into this open space called the epidural space. And so when I'm in the ligament, that needle is in a thick substance that when I push on this syringe, there's resistance and it doesn't give. But as soon as I break through that ligament and I'm in the epidural space, the needle lets resistance go through the syringe and I know I'm in the space. And once I'm in the space, I inject steroid medicine into the space to have a direct effect on the disc and the nerves to reduce inflammation. We pull the needle out and flush a little saline in when we do that to keep the steroid where it's supposed to be. Wipe your skin off with a little alcohol, put a Band-Aid on. We take you over, have you sit here for about 10 or 15 minutes as the anesthesia wears off, and off you go on your day. After the injection, we bring you back a week or two later, see how well it worked, and then start you on the program to empower you to get better. That's Empower Medicine, to empower me, which is you, to get better. We'll get you doing some exercises, some stretches, talk about things you can do in your lifestyle to keep this from being a recurrent problem. The whole process from the time you enter the door to the time you leave the building is probably 45 minutes to an hour. The time you're in this room is literally 7 to 10 minutes, and it takes me about 3 minutes to do the injection. Like I said before, it can be done with or without anesthesia. That's up to you, what you're more comfortable with. But that is an epidural steroid injection. That is why we do it. That is how we do it. Now, what do you think? Any questions?